Welcome to this special interview on the personal side of medicine, offering a unique perspective on the values and principles that have shaped the person who wears the white coat. I'm joined with a distinguished doctor who has dedicated his life to healing. Thank you, Dr. Patel, for coming and sharing your personal side with us.
Well, thanks for having me, Christina.
So, what inspired you to go into medicine and then later urology?
So medicine is something that I've always thought about doing. I love the idea of doing something that would help somebody else, instilled to me by my grandparents that always said pick a profession that you can go to work every day and feel like you've changed somebody's life. And as cliche as that sounds, it stuck with me. And so that was my initial calling to medicine. And urology was a different kind of. I didn't go into medical school thinking I was going to be a urologist, but it was a personality fit for me. It was people that had a sense of humor and loved what they did. They did serious surgeries, but they always had a good time doing it. And the toys that we play with, the innovations and the robotics and things like that's always been kind of a plus. And it's been a dream come true.
Well, so what do you pursue outside of work, hobbies or interests that influence the work you do?
Yeah, so I think one of the things that I love to do is kind of start my day with doing something active, whatever it may be. Either going out for a run, going for a bike. It just kind of sets my day. And a lot of times people say, Dr. Patel, you must wake up at, 4 o'clock in the morning, and sometimes that's true. And no matter how long my day is gonna be, I know that if I start my day doing something, it gives me more energy to get through my day. And so that's one of the things that always kind of keeps me grounded and gets me, kind of happy and excited and go to work with a lot of energy, and which I hope to keep throughout the day. In terms of hobbies wise, I've got 3 kids, and as you know, they are rambunctious little people that keep me on my toes all the time. And as soon as I get home, it's turning on my second hat, being a dad. And it's either going golfing with them, going and playing tennis with them, going to soccer with them, basketball, swimming. I mean, you name it. It's a lot of fun, but they definitely would be something that's more difficult for me because being a dad is a lot harder than being a urologist.
That's true, being a parent. Um, what personal experiences have you gained through your work that have influenced your worldview or personal value?
Yeah, so every person's different, and every patient that you treat is different. I recently had a patient that I saw yesterday that was initially homeless, came in with a real problem, and through the work of our team, we were able to get him back through an operation and back on his feet. And he came to my office yesterday and said that we changed his life, and he's here because of what we did for him. And I immediately called my nurse on the phone because I wanted to make sure that he heard that, because it's not just me that was doing everything for him, but it was a team. And UCI Health has the best team that I've ever worked with, and I need to make sure that other people on our team realize that the work we do is so important and it really is life-changing for folks. And he made me this, does air painting and airbrushing, and he brought me this shirt that says, Dr. Patel, best doctor ever. I wore it at home and my kids loved it.
That's so cute. Well, so what do you find is most fulfilling and motivating about the work you do?
Um, Honestly, it's twofold. So the clinical part of it's a lot of fun, and we take care of a lot of people and do a lot of disease management, a lot of surgeries. But really, the thing that kind of drives me and gives me the passion for urology, especially at UCI, is the academic side of it. We're training the future physicians of the world. At any one point in time, we're doing 40 to 50 clinical projects where we're really trying to understand what we can do to be better surgeons and what we can do to change the way medicine's practiced today. So it's that innovation and it's that curiosity that we're allowed to do here that patients don't get to see, but that's what we do in a lot of our time, is really trying to figure out what we can do to make surgery better.
Well, what do you believe are the most important technical and personal qualities that make a successful urologist?
Yeah, so technical wise, I think being just taking it easy, being slow and methodical, and also just, doing good work and working hard, but also having a lot of fun doing it. And we do that here. Every day we work with a team that has a lot of fun, whether we're doing complicated surgery, routine surgery, it's all just, all in it together. And so technically, I think it's one of those things that you just have to be confident in what you do and know that you can take care of that person. In terms of the other aspect of it, seeing and understanding what the patients need. Every patient's different, and what they need, and even if they have two of the same people have the same disease process, it doesn't mean that they need the same treatment. And it really is understanding what would make their lives better, and trying to figure that out. With the two of us, and even with our family and our team, to figure out what we need to do to help them, is kind of personally very challenging and enjoyable.
Well, so then how do you cultivate these skills like of effective communication and building of trust between your patients and their families?
Yeah, so it's funny and it's kind of cliche, but people would say that there's an art to medicine, and I 100% believe in that. You have to develop a rapport with folks, and really understanding where they're coming from and who they are is such an important part of it. One of my nurses the other day had said that, Dr. Patel, how do you remember certain things about people, what their dogs' names are, or where they were from, or how you guys shared a connection that you were both from some small town in Oklahoma. And I don't know the answer to that. I don't know how I remember these things, but it's one of those things that just stick with me. Whether even meeting someone for 5 minutes, it's stuff that I will remember, and it's establishing that rapport with folks that is it's a lot of fun, and really helps you understand and get to a level where you're not just a provider or you're not just a surgeon, but you're really somebody's friend that's trying to get them through a difficult problem, and that's the fun and exciting part for me.
So then how do you address patients who are hesitant or concerned about coming and seeking your care?
I think really telling them that these concerns that they have are real, and if you're not concerned about what you're doing, what kind of diagnosis you have, and what someone's going to treat you with, then you're just kind of hoping for the best. And those that are concerned, I feel, are some of the most challenging and most rewarding patients to treat, because it's as I mentioned before, it's the art of medicine where you have to help them understand what their disease process is, help them figure out what the fear of the unknown is, and really kind of show them what they've got going on, whether it has to be looking at imaging, going over lab reports, or drawing on, I love drawing on things, and I'll try to draw out exactly what their, diagnosis is, and how we're going to treat them, and kind of helping them get to the point where they feel comfortable with what you're doing, and helping them understand how that's going to ultimately benefit their health is the challenge, but it's a challenge that I readily accept. It's the fun part of it.
Yeah. Well, then, so how are you involved in and preparing for all the changes that come to the field of urology?
Yeah, so I'd like to say that we are the leaders and the innovators in terms of urology. We, at any one point in time, have about 50 clinical projects going on, and that's just the clinical side of it. And we're trying to figure out new ways of helping people, new surgical ways of treating people. But the other part of it is really the lab aspect of it. The patients don't get to see that I spend a lot of my time mentoring medical students, undergraduate students, even other resident doctors, and through the work that we do in terms of in the lab where things are going on, we're really trying to figure out new instruments, new ways to take care of people, and hopefully ease human suffering with what we're doing to people is a fun part of it. So the technological advances that we come up with in our lab, we try to then share that with other people. We hold teaching courses where we're teaching other urologists in the community how to do surgery, how to take care of folks, and that's really rewarding.
Yeah. Well, your dedication to your patients and profession is really inspiring, and we wish you all the best in your continued efforts to make a positive impact on this world.
Well, thank you so much.
Let us all take a moment to reflect on the values and principles that drive our own lives and impact we can have on the world around us. Until next time, this has been a special interview on the personal side of medicine.